Hello, I'm Dr. Joe Jingi. Today, I'm going to talk about a dramatic discovery that might be the hottest topic in the medical world right now. The topic is the surprising relationship between sleep apnea syndrome, or SAS, which many people suffer from, and the popular weight loss drugs currently making waves. Now, let's begin this detailed 10-minute video exploration into how these medications are changing the landscape of sleep medicine forever. Hello everyone. Suddenly, have you ever woken up because of your or your family's loud snoring, or felt overwhelmingly sleepy even after a good night's sleep? That might be sleep apnea syndrome, a condition where breathing repeatedly stops and starts during sleep, leading to poor oxygenation and extreme fatigue. Until now, the gold standard treatment for this condition was using a device called CPAP, which delivers continuous positive airway pressure through a large, often cumbersome mask. While effective, many patients find these masks difficult to tolerate. They are cumbersome to wear, noisy, and challenging to take on business trips or vacations. Amidst all this, news has emerged that has sent shockwaves through the medical community. Incredibly, data shows that weight loss drugs are showing remarkable results. We are seeing evidence that obesity treatment drugs currently attracting worldwide attention can dramatically improve sleep apnea symptoms, potentially offering an alternative to CPAP. You might be thinking, wait, how does a diet drug work for a sleep disorder? It sounds too good to be true, but the science behind it is fascinating and robust. Today, we'll explain the surprising mechanism and the latest research findings from major clinical trials in the clearest, most scientific way possible for you. A groundbreaking research finding has recently been published in the New England Journal of Medicine, which is arguably the world's most authoritative medical journal. The study focused on a medication containing an ingredient called tirzepatide. It is a dual agonist that targets both GLP-1 and GIP hormone receptors in the body. While it has a complicated name, you can think of it as a type of weight loss medication that has been approved here in Japan for treating obesity and related conditions. A large-scale clinical trial, known as a Phase 3 trial, was conducted to test its efficacy, specifically for sleep apnea. The results were nothing short of astonishing to researchers. To understand the results, we first need to look at the AHI, or Apnea-Hypopnea Index. This numerical value measures how many times breathing stops or becomes shallow per hour. In clinical terms, 5 or more events per hour is considered mild. 15 or more is moderate, and 30 or more events per hour is classified as severe sleep apnea. The participants in this specific trial were patients who suffered from severe sleep apnea accompanied by obesity, making them a high-risk group for cardiovascular issues. The results showed that with continued use of this medication, the number of apnea events per hour decreased by a remarkable amount, up to approximately 29.3 times. Percentage-wise, this represents an incredible 58.7% improvement from the patient's original baseline state before they started the treatment. Can you imagine how life-changing this is? A patient experiencing 60 apneas per hour, one every single minute, saw their condition drop dramatically into the moderate range. For many patients, this meant they were no longer in the most dangerous, severe category. This is truly a dramatic level of therapeutic effect, rarely seen with non-mechanical treatments. The implications are vast. If medication can provide this level of relief, it could change how millions of people manage their health and their sleep quality every night. This study isn't just about weight loss. It's about the systemic health benefits that come with metabolic improvement and how that directly affects the respiratory system during sleep. Beyond just the AHI scores, researchers also noted improvements in other health markers, suggesting a comprehensive benefit for the patient's overall well-being and longevity. Medical experts around the world are now re-evaluating the treatment protocols for SAS, considering weight management drugs as a primary or adjunctive therapy for the first time. So, why does taking weight loss pills make breathing smoother while sleeping? This will be a slightly technical explanation, but I'll try to explain it as simply as possible. One of the biggest causes of sleep apnea in many patients is the accumulation of fat around the airway. This excess tissue creates a physical obstruction that blocks airflow. Imagine this. When you drink juice through a straw, if you squeeze the outside of the straw with your hand, it becomes difficult to suck the contents out, right? The same thing happens at the back of your throat. When you gain weight, fat accumulates around your throat and at the base of your tongue, putting pressure on your airway. When you sleep on your back, gravity pulls that excess tissue and fat downward. The weight of that fat completely blocks the airway, leading to the pauses in breathing. The drug used in this case, tirzepatide, works on the brain to induce a feeling of fullness. It mimics natural hormones that regulate appetite and metabolic rate. In short, the medication helps the body shed excess weight. Crucially, it targets the visceral and subcutaneous fat that was previously blocking the patient's airway. It's like letting go of a straw you've been squeezing. As the fat is removed from around the throat, the physical pressure on the airway is finally released. Therefore, air reaches the lungs more smoothly while you sleep. This dramatically reduces snoring and, most importantly, eliminates or reduces the dangerous apnea events. Clinical imaging has shown that the volume of the airway actually increases as weight is lost. This isn't just a chemical change, it's a structural improvement to the patient's body. So, to summarize this section, the drug promotes weight loss, which physically opens the airway by removing the fat that was previously causing the obstruction. Simple, yet powerful. This discovery highlights the deep connection between metabolic health and respiratory function. It's a holistic approach to treating what was once seen as a mechanical problem. By addressing the root cause, obesity, we are not just treating a symptom, but improving the entire physiological environment of the patient's body. As these medications become more widely available and understood, they may become a standard part of the toolkit for many different specialties, including sleep medicine. This shift from device-first to metabolic-first treatment is one of the most exciting transitions we've seen in the field of sleep disorders in the last decade. It emphasizes that sleep health cannot be separated from overall health. They are two sides of the same coin, and treating one often leads to significant improvements in the other. For many, this is a return to a natural state of breathing that they thought was lost forever. It's about restoring the body's own ability to maintain an open airway. So, to summarize this section, the drug promotes weight loss, which physically opens the airway by removing the fat that was previously causing the obstruction. Simple, yet powerful. Up to this point, you might think, amazing. If I take that medicine right now, I won't need CPAP and I'll lose weight, killing two birds with one stone. However, as a doctor, I must be a little strict and serious in explaining the points to be careful about. This medicine is by no means a magic pill that works for everyone. There are three main points to be careful about. First, it is less effective for patients without obesity. Not everyone with SAS is overweight. If the cause of your sleep apnea is not obesity, but rather a small jaw or a naturally narrow airway, this medication will not cure apnea even if weight loss occurs. Second, not everyone can stop using CPAP. While the AHI numbers improve significantly, they don't always become completely zero or return to a normal range. Even if the severity decreases, some cases may still require continued treatment, such as CPAP, to ensure full oxygenation and long-term health benefits. Third, long-term safety and efficacy need further verification. We have seen great results over a year or two, but what about 10 or 20 years down the line? Will it truly reduce the risk of heart disease and stroke in the long term after taking it for many years? This requires further research and clinical follow-up. We also have to consider side effects. Like any powerful medication, these drugs can cause gastrointestinal issues that might make them difficult for some patients to tolerate. Cost and accessibility are also major factors. These treatments can be expensive and may not be covered by insurance for all patients, depending on their specific diagnosis. It is also vital to remember that medication is meant to complement, not replace, healthy lifestyle choices like a balanced diet and regular physical activity. The best treatment plan is often a combination of therapies tailored to the individual patient's needs, history, and physiological profile. Every patient is unique. What works for one person may not be the right choice for another. This is why a thorough medical consultation is absolutely non-negotiable. So, while we are incredibly optimistic, we must remain grounded in the current evidence and approach these new treatments with the necessary clinical caution. The medical community is working hard to answer these remaining questions. As more data comes in, our understanding and treatment guidelines will continue to evolve. In the meantime, these cautions serve to ensure that we use these powerful new tools in the safest and most effective way possible for every patient who needs them. Your health is a long-term journey, not a quick fix. By understanding the limitations of new drugs, you can make more informed decisions alongside your healthcare provider. Stay informed, stay cautious, and always prioritize a holistic view of your health. Now let's look at what this all means for the future of medicine and your sleep. Knowledge is the best medicine. Understanding both the benefits and the risks allows you to navigate the changing landscape of modern healthcare with confidence. The goal of all these advancements is simple: to help more people live longer, healthier lives with better sleep and more energy for the things they love. What did you think about this breakthrough? Until now, the treatment of sleep apnea has mainly focused on physical procedures and devices. The emergence of a powerful new option treating the root cause, which is often metabolic health and obesity with medication, is a truly exciting advance. This represents a shift toward more personalized and systemic medicine. We are looking at the whole person rather than just a narrow set of symptoms. If you or a family member are suffering from snoring or daytime sleepiness, the first step is always to consult a sleep medicine specialist for a proper diagnosis. Don't ignore the signs. Sleep apnea is a serious condition that can lead to heart disease, high blood pressure, and other life-altering health issues if left untreated. Today we've seen how tirzepatide can reduce AHI by over 50%, the physical mechanism of airway fat, and the important cautions to keep in mind. We will continue to deliver the latest news on global medical advancements in an easy-to-understand way, keeping you at the forefront of health innovation. I hope this deep dive was helpful for you. Medical science is moving faster than ever, and it's an honor to share these updates with you. Until next time, take care of your sleep and your health. This is Dr. Zhou Jingyi. See you in the next video. Goodbye.